Hey guys, this is Ohio Nursing Home Abuse malpractice lawyer Will Eady, and I just got off the phone with the gentleman who was calling because his father had had significant unintended weight loss in a nursing home facility, and despite his efforts and his insistence to the nursing home do something, had a continued decline until he really aggressively intervened and actually got some support from other caregivers. So I wanted to take a second and discuss my thoughts on how to ensure a nursing home is taking your loved one's unintended weight loss, or I'll say dehydration as well, which can manifest different ways, seriously, and they're doing something about it. So number one, if you have a loved one who is in a nursing home who suffers unintended weight loss, significant unintended weight loss, which they do as a percentage, 5% in a month, for example, number one, they should tell you about it. So if they're not telling you about it, that's a problem. Number two, they need to be taking it seriously. And how do you know if they're taking it seriously? Number one, ask for a care conference. If you can bring someone with you, bring someone with you, and insist that they identify, particularly have a dietitian or nutritionist there, a nursing staff member there, and ask them to identify exactly what changes they're making to the care plan. And ask them to write it down and put it in writing for you. Here are the changes we're making. Some of the changes might be diet changes, changing the food, adding Ensure or Boost or some kind of supplement, and trying to address it. And then every single month, you should be getting a report. You should be asking them, how is the weight? Is it improving? What changes are you making? If there's still weight loss, what else are you going to do? And insist that they get that. So don't let them poo-poo you. Don't let them say, oh, we're working on it. Don't worry about it. Make them get specific. You have the right, particularly in Ohio, I will tell you have the right, if you are the resident sponsor, to get clear answers about what the care plan is and to get that in writing. Number two, and this is, so number one, don't let them poo-poo you. Insist on getting the information on what they're going to do. Number two, observe what's happening and try to figure it out for yourself. Now, I don't say that because it's your job. I don't say that because you ought to be the one who has to figure out what's going on. That's not your job. It's the nursing home's job. It's the physician's job. It's the dietitian's job. But I see all too often where nursing homes don't figure it out, and they don't work hard to figure it out. And they act like if someone's losing weight, it's just their time and they won't be with us. So, for example, something I hear a lot is, well, they would come by and drop the tray off and then leave. Okay, but mom or dad, they couldn't use the utensils well, or they'd start eating, but due to dementia or due to mental status changes, they'd put the fork down and they'd forget to start eating again. It wasn't that they weren't hungry. It wasn't they wouldn't eat if someone helped them. It was that they couldn't process it themselves to keep eating. Another thing I just actually heard about was this idea that when your eyesight isn't great, particularly with dementia, that you want to look at the visual presentation of the food. And so what you see in some of these settings is they'll have a black tray, a black bowl. It'll be covered with, a black cover to keep it warm. And this is probably a great design choice, right? This is a great aesthetic for a hospital setting or something. But to a resident of a nursing home who has some cognitive limitations, they don't see food there. They're not recognizing, it's not clicking for them. They need to see colorful food. They need to see the right utensils. They need a contrast between the color of the fork and the tray so they can see and say, oh, there's the fork, I'm going to use it. Why do I want you to try to figure out what's going on? Well, you can then, armed with that information, request a care conference, present that information, make sure they're writing it down in the notes, okay? Ask to see the notes from the care conference. Ask to make sure that it includes things you're telling them, like she needs assistance. She's not eating when a tray is just being left there. And that will spur them to have to take seriously those questions, because they know if later we get investigated, it's going to be in the notes 2 months before mom died that the family was saying she needs assistance with eating, and so we better provide that. Number three, go for therapy. Look for a therapy option. whether it's physical therapy, even better, occupational therapy. If mom or dad has a primary care doc, now there's two kinds of primary care docs. There's the house doc, okay, who's just whoever they sign up, and they have 80% of the patients in there, and they may or may not see the residents. They may have a nurse or a nurse practitioner come in instead of them. And then there's an actual family physician who, treats every patient, like whether they're in a nursing home or not, like they're a real patient. So you're going to have to massage each of those a little differently. But what you're looking for is an order for a physician for an assessment of the need for assistance with eating. Okay. And once an occupational therapist sits down, does the evaluation, puts food in front of them, sees how well they eat without assistance, sees how well they eat with cueing, verbal cues. Martha, you need to pick up your fork. Remember to keep eating. If that's sufficient, great. Or do they need physical help lifting? And do they need help remembering to chew, to swallow? Is choking a risk? All of these things are things that therapists are specialized in addressing. And I'll tell you, in my experience, and I've been in a lot of nursing homes, I've sued a lot of nursing homes. In my experience, the therapy department is one of the best staffed, most qualified departments. And the reason is they bill on one-on-one care. They bill on assessments. They have to justify the care needs. They have to justify their conclusions for billing. And so there's no opportunity for them to understaff like the nursing home company will do with their nursing staff. So you might have great nursing staff. You might have really caring people. But if you can only give adequate care to 10 people with this level of care need, and the nursing home says, well, tough luck, you've got 20 residents, it doesn't matter how well-intentioned you are, you can't help. Therapy, that doesn't generally happen. You're entitled as a sponsor to attend therapy. I would treat those therapists as an ally, and I would, unless proven otherwise, and I would say, can I attend and help understand what their needs are? Can I speak with you afterwards to make sure I understand? Can I understand these orders you're putting in place for the level of care that the nursing home needs to provide? I don't understand what that means. Could you help me understand what moderate assistance means versus minimum assistance versus cueing or supervision? Okay. Now, once you're armed with that, number 4, insist that the nursing home gives a level of care. Okay. So it could be they need assistance one-on-one eating. Well, you need to say to the director of nursing, to the administrator, it says mom needs one-on-one care. Are you doing that in the room? Because what I see is that people are bringing in trays and the aides are too busy and they leave. So who's going to do it? Does that mean mom needs to get to the dining room where you have people who can provide some help, assistance, things like that? What is the intake? Are you tracking her intake? They'll do a percentage. How accurate is that? They ask all these questions, and then I don't know if I'm number 5, number 6, verify. Okay, whatever you figured out, whatever you're able to do with the therapist, find a way to verify. That means if you are visiting, if other people are visiting, try to go around meal times, try to observe and document, and let people know. So if your daughter, mom's granddaughter visits on Tuesdays, arm granddaughter and say, I'd like you to see, are they leaving the food trays or are they taking it to the dining room? How much is she eating? And I would keep a log, okay, with a date and how much food they ate, because somewhere down the road, you can request those records and see what they're documenting. And if you're showing she ate a quarter of her meal, that's a red flag that should be going off. That information should be communicated to the nutritionist. Things should be changing. But if you go back and look at those records and they're saying 75%, 50 to 75% on every meal, they're not going to be putting up red flags. And that dietitian, nutritionist isn't really going to have the information he or she needs to make a good decision. So document. I think whatever notebook works for you. Some people love calendars, paper calendars. Get a separate one and just start writing in date, time, what you observe, and report that back to them. And personally, particularly with the worst nursing homes, and unfortunately, sometimes you don't know which nursing homes those are until it's too late. I would, if you communicate that information to the nursing home, I would put it in writing. Because 2 months from then, no one's going to say, oh, yeah, Susan told me that she was only eating 25%. Okay, well, why didn't you do anything when you see the documentation that says 75% when you know that's wrong? They're not going to say that. But if you can get an email, if you can send letters, always keep a copy of the letter. If you can, I prefer a letter by email, so everyone has a copy. If you can do that and say, I saw on this date, on this date, on this date, on this date, the food wasn't eaten, it was cold when I arrived, someone needs to address this, and then something happens later, you'll be armed with that information you need. So my goal here is to try to arm you with information to help you fix things. So I love it when I can talk to somebody and say, you know what, I can't help you. I can't sue a nursing home. I don't have the damages there, when they had the support structure to force the nursing home to do a good job and turn the situation around. But I also love hearing that, because that's a great story. That's what I want. I wish I didn't have such great job security in what I do. So I hope this helps. Leave some comments wherever you're watching this or on our website. Don't put anything confidential, the attorney-client stuff, but leave a comment. Let me know what's going on. I'll do my best to follow up, give you some advice. And just remember, if you think there's a problem, there's a problem. Don't let anyone tell you different, okay? I wish you guys the best, and let's help end nursing home abuse.